Hello everyone, here I am going to discuss an ultra important topic, that is shock. You very frequently get a long question in your university exam on one of the three shock. Either you get a long question on hypovolemic shock or cardiogenic shock or septic shock, but very frequently you are going to get a long question on the shock. Sometimes you get a short question on only on pathogenesis or symptoms or the causes of each of the shock. So we will be covering everything here. So let's start it. So let's start the topic, shock. So first of all, I will tell you the introduction, the definition of the shock. What is shock? You must understand it. What do you mean by shock? Then I will tell you the classification of the shock, in which there are three important shocks we are going to discuss: hypovolemic shock, cardiogenic shock, and septic shock. For each of them, we will see the introduction, causes, pathogenesis, and symptoms. In the end, we will see the morphological features of shock, which is common for all the shocks. So let's start the introduction, the definition of the shock. What is shock? So students have very confusion that what do you mean by shock? You know, from head to toe, human body is supplied by blood. From head to toe, all the organs have the blood supply, all the organs. Now imagine if all the organs are not getting perfusion or not getting the blood simultaneously. If all the organs or multiple organs are not getting blood due to various reasons, I will tell you the reasons. Different shocks have different causes, but ultimately there is poor tissue perfusion, which is common in all type of shock. I will be discussing three shocks here now: hypovolemic shock, cardiogenic shock, septic shock. One thing is common in all three shocks is that there is poor tissue perfusion. What do you mean by poor tissue perfusion? From head to toe, multiple organs are not getting blood simultaneously. So what will happen? Because of poor tissue perfusion, which is common in all three shocks, because of poor tissue perfusion, all the organs are not getting enough oxygen. Multiple organs are not getting enough oxygen. So if the oxygen is not adequate, there is anoxia, hypoxia or anoxia. That will lead to cell death. The cells of that particular organ start dying. So multiple organ failure will occur. First cell death will occur, then organ death will occur, organ failure will occur, then whole body failure will occur, and ultimately death will occur. So shock is a syndrome. Shock is not one disease. It's a step by step, it's a syndrome. So what is shock? One thing you have to learn in shock is there is poor tissue perfusion. Whatever is the type of shock, the story starts with the poor tissue perfusion. The cause of the poor tissue can be different in different type of shock, but ultimately there is poor tissue perfusion. So from head to toe, multiple organs are not receiving the blood simultaneously. So multiple organs, the cells in that organ start dying. First the cellular death is there, followed by organ death is there, organ failure, followed by multiple organ failure, followed by whole body failure, followed by death. So this is shock. So how to define shock? Starting is whatever is the type of shock, ultimately there is poor tissue perfusion. So multiple organs are not getting the blood. What it will lead to? So multiple organs will have hypoxia together. So first there is cell death, then there is organ failure, then there is multiple organ failure, then the whole body failure, and finally death. So this is shock. This is how you have to define shock or write the introduction of the shock. After that, coming on the classification of the shock, there are three important shock: hypovolemic shock, cardiogenic shock, and septic shock. Now for each of them, you have to tell me the introduction, pathogenesis, causes, and symptoms. So let's start the first type. So I request all my dear students to make this comparative table with me. If you are reading from the soft copy, please make this table, take out your notebook and pen. Please make this copy with me. And if you are have my book with that, the hard copy, so this table is already provided to you. You can write there only. So let's start with the first type of shock, hypovolemic shock. Start with that. What is the introduction? Among the three type of the shock, this one is the most common. This one is the most common type of shock among all the shock. And it is due to decreased blood volume. What do you mean by hypovolemic? Acha, how much fluid is present in an adult human body? In every adult human body, there is 5 liters of fluid. 5 liters of plasma is present in all of us. Total 5 liters of the fluid is present, right? Now imagine someone have an accident, road traffic accident. Someone have a surgery, someone have diarrhea, someone have vomiting, okay? Someone have bleeding. Due to any cause, this 5 liters got reduced. So volume in the body is less. That is the meaning of hypovolemia. Hypovolemia. Volume is less. That is hypo means less. Volume of the fluid present in human body. Normal fluid present in human body is 5 liters. So it will be less than 5 liters. Why it is less? Why it is less? The person can have road traffic accident in which the blood bleeding is there, so fluid is lost in the bleeding. The person has surgery, in the surgery bleeding is there. In vomiting, the fluid is lost in vomiting. In diarrhea, the fluid is lost in the stools. So whatever is the cause, ultimately less than 5 liter of blood is present. Now whenever 5 liter of blood is present, so all the organs are getting adequate blood. But whenever less than 5 liter of blood is present, so all the organs will get less blood. So all the organs, you can see here, all the organs are receiving less blood, all the organs. Because blood is itself less in human body. In human body, normally if it is 5 liter, everyone is getting equal blood, or I mean the proportional blood. But here if it is less than 5 liter, so all the organs are receiving poor tissue perfusion simultaneously. So that is the cause here, hypovolemic. The name itself indicates it's hypovolemic shock. It is decreased blood volume. The causes I already told you, it can be acute hemorrhage, bleeding, diarrhea, vomiting, burns. In burns, the fluid evaporate. Excessive use of diuretics or acute pancreatitis, also the fluid loss is there. So these are the causes. Or surgery, acute hemorrhage, you can write the example, road traffic accident, surgery, in which the acute hemorrhage, the bleeding is there. So in all these causes, the fluid is lost. Now what is the pathogenesis? You have to write down the pathogenesis like this. In hypovolemic shock, whatever is the cause, maybe hemorrhage, trauma, surgery, burns, dehydration, diarrhea, vomiting, whatever is the cause, ultimately in the body, there is less blood, less than 5 liters of the blood. Most of the blood is lost. Less than 5 liters of blood is there. So less venous return. Less venous return means less cardiac output. Less cardiac output means less flow to all the organs. All the organs will receive less blood. Because venous return is less, cardiac output is less. So all the organs, there is less blood in aorta. So all the organs receive less blood. Less oxygen. Less blood means less oxygen. All the organs have anoxia. So first cell death, then organ death, then multiple organ death, then whole body failure, and then shock. Ultimately it leads to shock. So you have to write the pathogenesis like this. So what are the symptoms here? The person have high heartbeat. The heartbeat is more. The patient is having tachycardia because the heart is trying to compensate. Because all the organs are getting inadequate blood. Now heart is trying to compensate by doing tachycardia. And if you measure the blood pressure will be low. The blood pressure will be low because it is less blood. The blood is 5 liter. We have blood pressure of 120/80. But when the blood is less than 5 liter, the blood pressure will be less. It will be less. The patient will be having hypotension. So patient have tachycardia and hypotension. Heart rate is more, but blood pressure is less. So this combination, the deadly combination seen in shock. And all the organs receive less blood. Now all the organs, kidney receive less blood. That's why patient have oliguria or anuria. And brain also receive less blood. That's why patient have altered mental sensation. Kidney and brain are two most sensitive organs. Although all the organs are receiving less blood, but most commonly the respond is kidney and brain. Kidney mein there is oliguria, and in the brain there is altered mental status. So that is the symptoms. So what are the stages? There are 3 stages in hypovolemic shock. Mild, stage 1. Moderate, stage 2. Severe, stage 3. So when less than 20% of the volume is lost. What is 20%? 1 liter of 5 liter. 5 liter, 20% of 5 liter is 1 liter. So less than 1 liter is lost. Still 4 liter is there. It's stage 1. 20 to 40%. I mean 1 to 2 liters is lost. But still 3 liters is there. It's stage 2. And more than 2 liters is lost. So less than 3 liters is present, is stage 3. So you have to write in terms of percentage, mild, moderate, and severe, stage 1, stage 2, stage 3. So we are done with the first shock. Out of the 3 shock, at least 1 is done. So we will be covering the next 2. First, revise this one. So hypovolemic shock. What are the causes of hypovolemic shock? So there is less blood volume. You can write down less than 5 liters. Less than 5 liters of the blood. Either due to hemorrhage, accident, surgery, vomiting, diarrhea, burns, diuretics, whatever is the cause. So write down the causes by your own. Okay. Now in the symptoms, the heart rate is more. The blood pressure is less. Kidney is getting less blood, so less urine output. And brain is also getting less blood, so altered sensation. Altered mental status, I mean. So these are the things about the hypovolemic shock. Let's start the next shock, the second type of the shock, that is cardiogenic shock. Let's start cardiogenic shock. What is the problem here in cardiogenic shock? You know, when the heart pumps, when the left ventricle pump, this is the left ventricle. So adequately blood is provided to all the organs. Adequately. The left ventricle is pumping. So blood is provided adequately via aorta to all the organs. All the organs are getting the blood. All the organs are getting the blood because left ventricle is pumping. Imagine this left ventricle is not pumping properly. Imagine if the left ventricle, there is 5 liter of blood in the body. In contrast to hypovolemic shock. Here, the volume is normal. 5 liter of blood is present. But the problem is that the left ventricle is not pumping. There is left heart failure. The person is having left heart failure. The left ventricle is not pumping. So there is Less blood going in the aorta, the less blood is ejected in the aorta. So all the organs receive less blood. So here the most important problem, there is circulatory failure. I mean the left ventricle is not pumping, properly not pumping. So here the blood is not going in aorta, so all organs receive less blood simultaneously. Although the blood is 5 liter, but still all the organs are receiving less blood. So that is cardiogenic shock. That is due to inadequate pumping of the heart. Inadequate pumping of the left ventricle of the heart. That is cardiogenic, as the name indicates, cardiogenic. So the cause is cardiac here. So here you can see the cause is cardiac. Here the left ventricle is not pumping properly, not doing the systole adequately. So less blood is ejected in the aorta. So all the organs receive less blood simultaneously. There is poor tissue perfusion in multiple organs together. What are the causes? Why the left ventricle is not pumping? Maybe there is deficient emptying or deficient filling. I mean, there is systolic defect or diastolic defect, or there may be obstruction in the outflow of the aorta. So systolic defect, there is MI in the wall of the left ventricle. There can be myocardial infarction, cardiomyopathies can be there, rupture of the wall, arrhythmias. Defective filling means the person can have a cardiac tamponade, and in obstruction there can be pulmonary embolism, wall thrombus, tension pneumothorax. So these are the causes because of which the left ventricle is not pumping properly. That is the causes. So ultimately, what is the pathogenesis? Whenever there is cardiogenic shock, either due to systolic defect, diastolic defect, or obstructive defect, whenever there is cardiogenic shock, the left ventricle is not pumping. Since the left ventricle is not pumping, the cardiac output is not adequate. The cardiac output is less. Less cardiac output, less blood is flowing in the aorta. Less blood flowing in the aorta, all the organs have less blood, less oxygen, anoxia, first cell death, then multiple organ death, then whole body death, whole body failure, and it will lead to shock. So that is about the cardiogenic shock. So what is the pathogenesis? Circulatory failure. The left ventricle is not pumping. If the muscle, the wall of the left ventricle is destroyed more than 40%, then the symptoms will manifest. What are the symptoms? Now, two types of symptoms are there. See, what are the symptoms in cardiogenic shock? Now, please imagine the left ventricle is not pumping. Please imagine. So two things will happen. The blood will not go forward. The blood will not go in the aorta. Since the blood will not go in the aorta, all the organs will receive less blood. It is known as forward failure. All the organs will have poor tissue perfusion. The kidney, the brain, all the organs. So if the blood is not going forward, where does the blood is going? The blood is going backward. The left ventricle is not pumping now. Blood is not going forward in the aorta, but blood is going backward. Blood is going backward into the left auricle. From left auricle, it is going in pulmonary vein, and from pulmonary vein it is going to pulmonary capillaries, and it get accumulated in the lungs, and it will cause pulmonary edema leading to dyspnea. So patient presents with dyspnea. This is known as backward failure. So blood is not going forward, it will lead to symptoms, and blood is going backward, it will lead to symptoms. You can see the person will present with dyspnea due to pulmonary edema. So here dyspnea is an additional finding which was not there in hypovolemic shock. In hypovolemic shock also, all the organs were receiving less blood, especially kidney and brain. I told you. Here also all the organs will not receive the adequate blood, especially the kidney and brain. But additionally, due to backward failure, here there is dyspnea. Dyspnea was not a feature of hypovolemic shock. I hope you got it. So see, we have covered two types of shock till now. Hypovolemic shock is done. You can see hypovolemic shock is done and cardiogenic shock is done. See the causes of both of them. Here the problem is that less than 5 liters of blood is present. And here the problem is that the left ventricle is not pumping properly. That is the problem. See the symptoms here. The same symptoms will occur here, but especially pulmonary edema is an additional finding which will lead to dyspnea, which is not there. Now coming on the last type of shock, septic shock, most difficult to understand. So let's start septic shock. What do you mean by sepsis? Sepsis means bacteria in the blood. So this is the blood vessel of a person, of a human being, inside which the bacteria is present. This is the bacteria. So this is known as sepsis. Sepsis means presence of bacteria inside the blood. So that is sepsis. So septic shock is due to sepsis. Now this bacteria can be gram positive, can be gram negative. Maybe this bacteria is gram positive, maybe this bacteria is gram negative. So gram positive and gram negative both can cause septic shock. Gram positive secrete exotoxin. That's why this shock is known as exotoxin shock. And gram negative bacteria secrete endotoxin. That's why this shock is known as endotoxin shock. So septic shock is of two types. Gram negative septicemia, endotoxic shock. Gram positive septicemia, exotoxin shock. So there can be exotoxin, there can be endotoxin, the two type of shock due to gram negative and gram positive respectively. It is due to sepsis. It is due to septicemia, sepsis, presence of bacteria in the blood. So you will be thinking how presence of bacteria in the blood leads to the shock. Means if the bacteria is present in the blood, How does multiple organs in human body get poor tissue perfusion? Ultimately, if the shock has to happen, all the organs in human body should have poor tissue perfusion. If there is poor tissue perfusion, it will lead to shock. All the organs are receiving less blood. Now in hypovolemic shock, the volume of the blood is less than 5 liter. That's why they all are not getting adequately blood. In cardiogenic shock, the left ventricle failure is there. The left ventricle is not pumping. That's why all the organs are not getting the blood. But what will happen in septic shock? How the bacteria, gram-positive and gram-negative bacteria, are leading to poor tissue perfusion. For that, you have to understand the pathogenesis. It's difficult. I'm warning, it's difficult. Please understand. Now imagine if gram-positive or gram-negative, any of the bacteria enters human body. Imagine this is gram-positive bacteria present in the blood or gram-negative bacteria present in the blood. Now gram-positive bacteria and negative bacteria, both of them have cell wall. In gram-positive bacteria, lipoteichoic acid is present in the cell wall. And in gram-negative bacteria, lipopolysaccharide is present in the cell wall. So gram-positive lipoteichoic acid, LTA, and gram-negative lipopolysaccharide, LPS, they will stimulate the macrophage. Gram-positive also stimulate the macrophage. Gram-negative also stimulate the macrophage. Ultimately, macrophage is stimulated. On the macrophage, different receptors are present. I mean, lipoteichoic acid bind with ILR2 and stimulated. And lipopolysaccharide bind with CD14 and stimulated. Ultimately, with different receptor, macrophage gets stimulated. What does macrophage will do? On stimulating, it will secrete cytokines, two cytokines, TNF-alpha and IL-1. TNF-alpha and IL-1. What does these cytokines will do? First thing, the cytokine will do vasodilation. So this blood vessel undergo vasodilation. Now this is the organ this blood vessel is supplying. This is the organ to which this blood vessel is supplying. Now you tell me, whenever there is vasodilation, the organ will receive more blood or less blood because of vasodilation? Obviously, there is vasodilation. So organ will receive more blood. You will be thinking, ma'am, what are you saying? You are teaching us shock. In shock, you are saying the organ should get less blood. And here you are telling the organ is receiving more blood. Then how it can be the shock? Yes, at initial stage, there is hyperdynamic stage. At the initial stage in septic shock is the unique shock in which there are two stages. In initial stage, there is hyperdynamic stage. I mean, instead of getting less blood, the organ is receiving more blood. It is reverse of shock because of vasodilation. Later on, there is increased vascular permeability. What do you mean by increased vascular permeability? See, the wall of the blood vessel is lined by endothelial lining. Normally, the endothelial lining is continuous. It's continuous, there is no gap. But now, due to the cytokines secreted from the macrophage, there is gaps. There is gap formation. You can see the gaps are formed between the endothelium. So the gaps are formed. From this gap, the fluid will leak out. All the fluid will leak out and accumulate here, leading to edema. Now there is less blood. And now there is less blood to the organ and it will lead to shock. So initially there is hyperdynamic stage followed by shock. Hyperdynamic stage is due to vasodilation. First vasodilation occur leading to hyperdynamic stage. And later on, increased vascular permeability leads to shock. So I taught you three types of shock. Now, the first I taught you is hypovolemic shock. The second I taught you cardiogenic shock. In hypovolemic shock, the blood is less than 5 liter of blood. And in cardiogenic shock, the left ventricle is not pumping. So in both of them, all the organs receive less blood from the beginning only. If you touch the extremities in these two shock, the extremities are very cold and calming, very cold. They are very cold because they are getting less blood. But here in septic shock, if you touch the extremities in initial phase, the extremities are warm. And later on, the person will go in shock. So what is the pathogenesis? Can you tell me the pathogenesis? Yes. So I'm teaching you septic shock. In septic shock, the bacteria is entering in the blood. There are two types of bacteria, gram-positive bacteria, gram-negative bacteria. Gram-positive bacteria have lipoteichoic acid in the cell wall. Gram-negative bacteria have lipopolysaccharide in the cell wall. Lipoteichoic acid bind with ILR2 receptor of the macrophage and lipopolysaccharide bind with CD14 of the macrophage. Ultimately, macrophage stimulated. On stimulation, macrophage secrete two cytokines, TNF-alpha and interleukin-1. So these two cytokines first cause vasodilation. So organ will receive more blood instead of less. So initially there is hyperdynamic stage, but later on, due to increased vascular permeability, the gaps are formed. And from the gaps, the fluid will leak out. And now the organ will get less blood and that will lead to septic shock. Inadequate perfusion and septic shock. So this is the story. I hope you got it. So yes or no? So initially symptoms may there is hyperdynamic stage because of vasodilation. So warm extremities are there. Later on, late hypodynamic stage is there and person have all organ failure together, multiple organ failure together. I hope you all got it. So whether the gram positive bacteria or gram negative bacteria, any bacteria enters in human blood, So gram-positive bacteria have lipoteichoic acid in the cell wall. Gram-negative bacteria have lipopolysaccharide in the cell wall. They will stimulate the macrophage. Both of them stimulate the macrophage via different receptors, ILR2 and CD14. The stimulated macrophage will secrete cytokines. Cytokines will first cause vasodilation. So this blood vessel undergo vasodilation. So organ will receive more blood, hyperdynamic stage. Later on, there is increased vascular permeability, that is gaps are created. From the gaps, the fluid will leak out. So less blood will be present now, and now there will be hypodynamic stage. So that's it. So we are done with 3 shocks. Let's compare them. What are the 3 types of shock? Hypovolemic shock, cardiogenic shock, septic shock. So what is the causes of hypovolemic shock? Hypovolemic shock is due to less than 5 liters of blood in human body. Maybe due to vomiting, diarrhea, hemorrhage, bleeding, burns, diuretics. Cardiogenic shock is due to left ventricular failure. Maybe due to MI, arrhythmia, cardiomyopathy, tamponade. And septic shock is due to infection, the bacterial infection, gram-positive or gram-negative. So first see the pathogenesis and see the causes. And now you can tell me the symptoms. So here symptoms are due to forward failure. I mean the symptoms, organs are receiving less perfusion. The symptoms are due to less perfusion. There is increased heart rate, there is less BP, and all organs receive less blood. Here also the organs receive less blood, but additional dyspnea is there. And here additional edema is there. I told you, in septic shock, the fluid leaks out. The fluid leaks out, accumulate here, leading to edema. So septic shock is a shock in which edema is an additional finding. So if the person present only with poor tissue perfusion, if the person present only with poor tissue perfusion, it's hypovolemic shock. If along with poor tissue perfusion, person presents with pulmonary edema also, I mean dyspnea also, it's cardiogenic shock. And if person presents with edema, it's septic shock. I hope it's crystal clear. Now coming on the morphological changes in the shock, which is common for all. So in brain, it will lead to ischemic encephalopathy. I told you there is multiple organ failure. Now, brain, there is ischemic encephalopathy. In the heart, there is coagulative necrosis, that is MI. In the liver, there is fatty change. In the kidneys, there is acute tubular necrosis. In the adrenal, there is cortical cell lipid depletion. And in GIT, there is hemorrhagic encephalopathy. So that is the morphological changes you can see. We are done with shock. Now, if any long question is coming either on hypovolemic shock or cardiogenic shock or septic shock, you have to write the introduction or definition of the shock. And after that, whatever is asked, one of them will be asked as a long question. Sometimes they can ask you all 3, rarely, but mostly they will ask one of them. So whatever they are asking, write down the introduction, causes, pathogenesis and symptom for that particular type, and morphology is common for all. So basically, whatever is asked, you have to write down the introduction and morphology in all of them. And whatever is asked, you have to write specifically that one only. So that's all about it. Have a look on all long question, short question, very short question and MCQs of this topic, which is given in the question bank section and notes section. So you will become confident that in university exam, if whatever question coming from shock, you can answer it. This is such a topic you cannot skip. I hope you got it. Thank you.